let's acknowledge the elephant in the room here, which is that yesterday and as of today, there's a lot of chaos going on, not only in Connecticut, but across the country with the executive order that went out. I think as the day goes on, people will hear more about litigation, people seeking injunctions, including here in Connecticut, to stop what is on its face an illegal order, an end around Congress, and causing the kind of chaos that we don't need in this country. To give you an example, right now, our commissioner can't access the Medicaid system here in the state of Connecticut. We have no idea if that's true of every state across the country. The FQHC's called and told me they'd be out of cash in about 7 to 10 days if this executive order was not lifted. So, with that as a backdrop, we still thought today was very important to go forward with, because we've relied in the state of Connecticut through Republican and Democratic administrations going back decades on the notion that investing in Medicaid, when the state puts in money, the federal government will be there as a partner. That increasing Medicaid rates provides better access for people to dental care and primary care. It means more money for people who provide children's mental health services. It means more money for our nursing home workers who work really, really hard jobs on a daily basis. It means that our hospitals are stabilized when they take in patients and are getting a little more money than they are today to make sure that their bottom lines are met. Nobody, not President Bush, not President Reagan, attacked the Medicaid system like we're seeing in this country today, because it has served as a good bedrock of public health policy and has helped keep people safe and free from all kinds of bad outcomes that could occur without the proper health care and the proper services. So we didn't want to cancel today. We wanted to be full-throated, let everybody in the state of Connecticut know that we understand what's going on nationally, but we can't stop doing our jobs, and we're not going to stop putting forth good public policies on our committees, and we're going to do our very, very best to increase Medicaid rates, which is long overdue 17 years later here in the state of Connecticut. It's been 17 years. And I applaud all the chairs that are here, approps in public health and human services, for the work they've done. And we have a really well thought out, rational plan which shows a path to increasing these services. And if it comes to pass in 90 days that the federal government decides to make changes to the Medicaid program through the budget reconciliation process, if that comes to pass, then obviously we're not naive. We'll have to adjust to the things that become law down in Washington. But I'll ask you this before I turn it over to the Senate President. Why would you, as a congressperson in Alabama, vote to gut the Medicaid program? How does that help anybody in your state? How does it help you in Arkansas to say to providers of dental care, we'll pay you even less, so less children get the services they need, the preventive services they need? How does it help a kid going through mental health issues in Wyoming to have the Medicaid process upended so now they can't pay providers so they don't take those patients? What you're really doing is saying to poor people, forget about basic services. You're not going to get them anymore. And you're telling providers, we're basically going to make you work for free if you're going to provide those services. It's a terrible idea. And maybe I'm naive, but I have a hard time seeing why anybody, or at least 214, whatever the magic number is, would vote for that down in Washington, D.C. So hope will spring eternal. We'll see what happens, but we're not going to stop doing the good work here in the state of Connecticut. And today still is a day for celebration because it may still come to pass.